week ago, since we received our first consignment of COVID-19 vaccines. The vaccine, as I stated, are a major milestone in the fight against the deadly disease, the deadly virus that has struck our country for the last 1 year. And indeed, on Friday, forms the anniversary since we announced the first case. If you recall, soon after the vaccines landed in the country, the following day, His Excellency President Uhuru Muigai Kenyatta flagged off the deployment of the vaccines to our various stores in the country. The move by the President is a clear indication that his government does not have time to waste when it comes to protecting the lives of Kenyans, especially in the fight against COVID-19. Today, I'm delighted to report that a number of counties have already commenced the vaccination of our health workers who are frontline soldiers in this war. And I'm glad to hear Governor Wambora say he is also in the front line, and I wish also to state that I agree with you and you should be vaccinated. This being a pandemic, we have employed all the available manpower to deal with this enemy. Towards this end, I confirm that all our 47 counties are working very closely with the national government. This morning, we had fruitful deliberations with the Council of Governors to see how best we can carry out the vaccination exercise, and we picked some of the advice also from the governors themselves on how we are going to improve this process. Fellow Kenyans, vaccination is a key intervention that could rapidly interrupt COVID-19 transmissions and reduce the burden of disease and deaths from COVID-19. Preliminary data from the phase 3 clinical trials suggest that COVID-19 vaccines are safe and effective. A national COVID-19 deployment task force was formed to advise and guide on COVID-19 vaccine rollout and is undertaking the tasks that include regulation and safety monitoring, costing, financing and resourcing, planning and coordination, procurement and logistics. The team is also mandated to undertake training and capacity building, advocacy, communication, and community mobilization, as well as data management, monitoring, and surveillance. Let me make it clear that we are using a very clear system so that we can build data, and the digital platform on which we have predicated the rollout of the vaccines ensures a number of things. It ensures transparency, it ensures accountability, it ensures data building, so that moving forward, there is nobody who will say or raise questions regarding the manner that we deploy the vaccines. There has also been some misconceptions and misleading information regarding the vaccines. For the record, the recent vaccines that we received are the AstraZeneca, whose efficacy and safety have been approved by the World Health Organization. On our part, the Ministry of Health recommends approval by a stringent regulatory authority and registration by Pharmacy and Poisons Board for any vaccines to come into our country. There are other vaccines that have been submitted for World Health approval, and they include the Sputnik, the Johnson & Johnson, the Sinovac, Sinopharm, Novavax, and these are all also going to be tested here in our country, and to ensure that the Poisons Board also approve them. Currently, the Pfizer, Sinovac are undergoing PPB evaluation. We have also established an independent safety monitoring board. This board will advise the ministry on any matters arising from vaccination program and ensure that in the event of anything, we immediately take corrective measures. Fellow Kenyans, with regard to deployment of the vaccines to the counties, there are very well-established structures that are mandated to deal with the vaccine exercise. They include the County COVID-19 Vaccine Steering Committee, the County COVID-19 Vaccine Deployment and Vaccination Task Force, and finally, the Sub-County COVID-19 Vaccine Deployment and Vaccination Committees. With all these structures in place, we plan to vaccinate about 15 million people countrywide, which is about 30% of our total population of 49 million by the end of June of 2023 in 3 phases. Kenya expects to receive vaccine support from Gavi to vaccinate another 20% of the population and also self-procure vaccines for 10% of our population, hence the 30%. The vaccination we have already rolled out is being carried out in 3 phases to progressively cover all target groups based on vaccine availability. The dates that we have announced are the farthest dates that we see as rolling out the vaccine to the entire population. However, as I have already indicated, if other vaccines also join the AstraZeneca pool, then we will be able to move a lot faster than we have indicated. And the speed at which we move at will entirely depend on the availability of the vaccine. This is a supply issue, not an efficiency issue, and not a vaccination issue. And as I indicated, we have a priority list with regard to the vaccination, which has started with our healthcare workers, to be followed starting today by teachers, security personnel, and then other vulnerable groups. The police are part of the frontline arrangement, and I think 3 o'clock today, the police will also start the exercise of vaccination, including starting with the IG, I think as we speak in his office. Further, to ensure transparency and accountability, this is where the ICT platform becomes extremely necessary. Therefore, I urge all Kenyans to be calm and to follow the guidelines we shall be issuing with regard to the vaccine as we continue. When the time for the entire population to be vaccinated comes, I will urge all Kenyans to take advantage of this opportunity and get this jab in order to curtail the transmission as well as protect ourselves from the virus. However, I want to continue making a passionate appeal to all Kenyans not to lower our guard in this fight, as the governor has ably demonstrated. Fellow Kenyans, I want to make it official today and to say that Kenya is already in its 3rd wave. There was the first wave, the second wave, which was around November, but as we had predicted in the Ministry of Health, come the month of March, we may begin to see some surge upwards. Today, we report the highest number since last year at 713 people who have contracted the disease, the virus, over the last 24 hours only. This is out of a sample size of some 5,230, but even as we increase the sample size to a minimum of 7,000, having received the necessary reagents, the sheer number itself tells you the whole story. Today, also, the positivity rate that we are announcing at about 14% is also the highest one since the last phase is sometime in November. I therefore want to support and agree with the Council of Governors that now the time has come to start looking back at some of the measures that we have taken, whether to increase and to stop and make some mandatory requirements of our population. And therefore, as we debate this matter today and tomorrow, the President will be speaking to us on Friday, and on that date, by that date, we will have agreed, and with our scientists, immunologists, and the modeling team, to see where we are going forward and the measures that we must take. I think all Kenyans will be aware that the third wave has been in other parts of the world, including Europe, with devastating effects. And our hope and prayer is that this is not what we are going to experience in our nation. Already, I think you have seen an increase in numbers of the cases that are in our hospitals. We have seen an increase in numbers of those who are on ventilators. We have seen an increase in number on those who need oxygen. And therefore, we must continue with vigilance to ensure that these cases do not overrun our healthcare system. 167 patients have also recovered, so it's not all gloom and doom. 115 from home-based care, while another 52 from isolation. And our recovery rate so far, it's a good one at over 80%. And therefore, we stand well in terms of recoveries across the country and indeed over the last 1 year. But again, you will recall that yesterday, we lost some 7 patients. Today, we have lost another 12 patients. And you can see the numbers are going up. So our cumulative total now has been pushed to some 1,898. Currently, there are 563 patients who are currently admitted in various health facilities across the country, while some 1,588 patients are now on home-based care. You will also note, as I had mentioned, that the number of patients in ICU have gone up. At 89 patients, nearly 90 patients are now in our intensive care units. And you will recall that this number had gone to even less than 20 sometime in January. And that does not even include another 28 patients who are now on supplementary oxygen. So, my good friends, in conclusion, let me say that we are about to start another difficult period. But I know that having overcome the first two, we can also overcome this one. I know that this time round, people feel tired. I am tired as well. People are strained. It's taken a toll on us over the last 1 year. But we also know that it is at this time, when we feel the way we feel, that we can let our guard down, adopt a don't care attitude, that then we will be hit hardest. And therefore, let's all work together. Let's renew our commitment. Even as this new one comes at us, let's renew our commitment to ensuring that we can save each other and save our loved ones.